Hi, Mark White here. I'm the president and founder of Idaho Estate Planning, and this is our Senior Matters Radio, the podcast. Those of you that were fans of the radio show, we did that for 5 years, 250 episodes.
Wow.
We got right to where we almost knew what we were doing.
And then stopped.
Then the COVID thing happened. Yeah, because for me, it's usually, as soon as it's really working well, then I stop.
Yeah, let's change it.
So, and as you know, our theme for the year is No Place Like Home. With all the COVID stuff, people were, just, you saw this. I'll introduce Kevin here in just a second. People were really nervous to go into any of the long-term care situations, whether that's assisted living, memory care, skilled. People were just concerned about that and so wanted to stay in their homes. And we are glad to help. And as you know, I've said it several times, that we want to make sure that if you do that, that you're safe and comfortable in your home, and you're having a high quality of life. Those are things. So today with me is Kevin Crumley. Did I say that right?
That's correct, yeah.
With Mountain Care Pharmacy. So today we're talking drugs. Not those kinds of drugs, but we are talking medications. Yeah. We'll use the term meds.
Yeah, prescription medications, meds, whatever works.
This sounds a little oversimplistic. It just doesn't seem, people are going, well, I can do my own meds, but you were saying before we got on that this is like mismanagement.
Mm-hmm.
Can I put that term out there?
That's a great one.
Is like the number one reason people cannot remain independent.
Yeah, like we were talking about, really my personal goal and a lot of the goals that we have for our patients is to stay as independent as long as possible.
Yep.
And what we've found over the time that we've been doing this is that, yes, the number one reason that people end up in assisted living facilities, certified nursing facilities, on hospice, get hospitalized, any of those general kind of next level services is because they're mismanaging their medications. Obviously, it's not the only reason, but it is the leading cause for going into that next level of care.
So then it follows, if they can get a handle on and be consistent with and be appropriate with their medications, they can be independent much longer.
Yeah, significantly longer. We've had plenty of, powers of attorney that come to us, 2 years, 3 years on and say, we were really close to putting mom or dad or, aunt or uncle or whoever else into an assisted living. And you guys were kind of the last step for us before we were doing that. And now the patient is still an independent adult living in their own home, actually managing their medications the way that they're supposed to be managed. The reason that you're taking all these medications is to make sure that you can function appropriately. So, yeah, it's a big deal.
And I would guess it's kind of like the dominoes falling
Mm-hmm.
over, right? If I forget to take this one and maybe 2 or 3 days that I haven't done that,
Mm-hmm.
that can lead to some confusion, and then
Yep.
I'm not taking these other ones.
Yep, it's all of the above, right? So the reason that you're going into these assisted livings is things like slips and falls. You're not managing your blood pressure the appropriate way. So what we see frequently is residents or independent people are not managing their blood pressure medication the right way, so they're falling. They're getting low blood pressure, get dizzy, fall over. Or like you were saying, cognitively, they they're getting confused. They can't remember if they took their medication, so they're taking multiple doses of stuff, or just a multitude of different reasons. Whereas if you were managing these medications appropriately, you would be completely fine.
Well, at least closer.
Well, yeah. No guarantees on the completely fine, right?
Closer to fine, maybe not completely fine. So, the med management, I think that's what we're talking, medication management is the term. We were talking about it. You were talking from the standpoint of being very organized,
Right.
which is what most care providers are hoping, right?
Yeah.
When they send you home.
Yeah. Perfect world scenarios,
Yeah,
right?
take 2 of these, one in the morning, one in the evening, every day, and so that's what they're expecting, hoping, and then we send them home, and it could be for an individual, it could be a family member, a power of attorney, whatever that situation is, and then that type of medication management, that's all over the board.
Yeah. Yeah. I mean, so it just depends on who's, helping do Medisets or who's.
Okay, well, back up.
Yeah.
What's a Mediset?
So just those little pill packs, right? I mean, everybody's seen them. It's got like Monday through Sunday on them. The little pop tops. They're really designed to just, kind of pre-sort their medications into, an easier to use kind of situation.
Yes. However, there are some folks that refuse to
Yeah,
use
yeah.
those.
So you end up with just vials of medications all over the place.
And you have no idea, by the way, how many you've taken, how many you should still have,
Yep.
and so the Mediset,
The Mediset.
that's certainly a good step.
For sure, yeah.
But again, the home-based med management, there's varying degrees of efficiency with which those work.
For sure. And one thing that we need to start realizing too is just as a community, there's plenty of pharmacies, not just our pharmacy out there, that is willing to do more, to assist more.
Got
I
it.
think that's one thing, even healthcare related in general, that we forget about, is that there's programs, there's different safety nets put out throughout all of the industry to try and keep these
Got it.
patients where they're at. So there's plenty of services out there. You just kind of have to find that right community
Got
partner to do
Well,
so.
it seems to me that the Mediset is a big step forward, just from the standpoint of daughter comes in, Dad, how you doing? Have you been taking your medication?
Right.
And they go in, they can look and pretty quick go, how come you took Thursdays?
Right.
Well, today's Thursday. We recorded this on a Thursday. So why did you take Saturdays? Oh, I thought it was Saturday.
Yeah.
So we then know if we're taking them or not,
Right.
and appropriate. So that's a huge step forward.
For sure.
And there's a lot of people that could do that. But there's also quite a few folks that still struggle with that help.
Yeah, yeah. So one of the issues that we find with some of those is that they're really set up for like that once a day scenario,
Yes.
right? I mean, you can find the ones that kind of are a little bit bigger, but really the service that we try to provide is we'll send out what we call a full blister card, right? So it's got 28 different blisters in it. It's labeled.
And a blister is that plastic
little
that
bubble.
goes over the top,
Yeah.
and you push that out, and
Yeah. So you can see if it's been taken or not. But basically, it's set up where it's morning, noon, afternoon, and evening or bedtime. And then it's got Monday through Sunday on it. So you can sit there and say, okay, a lot of different medications are prescribed for different times of the day.
Yep.
There's additional
before a meal, after a meal.
before a meal, after a meal, bedtime, take on an empty stomach. There's just a multitude of different things. So what we try to do in that is get those set in the appropriate bubbles or blisters so that you can actually physically see, this is when I'm supposed to be popping these out, Monday through Sunday, 4 times a day. It's a full on service, and it's a completely free service, Mark. So it's
So that's what's crazy to me.
yeah, but that's what I'm talking about as far as community providers are. There's plenty of people out there in your community that are vested in keeping people independent as long as possible.
Okay, so one of the first things to know is that you're not alone. That's the first
Right.
thing. You don't have to do this all by yourself. So if
sure.
you're sitting there, and I've talked to folks that are concerned, about
Yep.
different things, they're going, I'm not sure about this and that. Then a little bit of homework. You can always call the Mountain Care Pharmacy. You can look them up online, and I know most of you are, able to do that. We make that joke often.
Yeah.
And so this is a way now. I see. Let me. I'm seeing a couple of things with this. One, if we have that laid out, then we've organized the entire week. It's all here. We know what we have to do.
For sure.
We know if we're taking an appropriate, dosage because it's all in front of us.
Right.
And most people don't do that. They don't
No.
sit down on Monday night
Nope.
and organize everything. Most people don't.
Yeah,
The metasets can help
for sure.
if we got the right stuff in there,
Yeah.
right? And I was joking before we came on that those pill bottles are.
Oh, yeah.
My wife has
The
a
child
little
safety ones, yep.
arthritis, and to push down and turn it is very difficult.
Yep. One thing to remember on those too, even if you don't use the medication management services, is that there's a lot of different pharmacies out there that offer easy to open pill bottles. You just have to request that. So have them set it, even if you're at Walmart or Walgreens or Fred Meyer or wherever else, just have them set on your profile that you need the easy to open. We call them snap caps in the industry. Some of them are just the non-child proof safety ones.
Very good.
Again, that's just kind of a, per patient specification. So, if you have a bunch of grandkids or something running around, be careful about that stuff because it is easier to open. But, if it's in a safe, secure place, by all means, they have different
Got it.
different ways of keeping those.
So a couple things in that then. Again, one, you don't have to do this all by yourself. You can
Exactly.
get professionals to
Yes.
help. And two, there's a number of ways to deliver this. If you're saying, well, I'm not old enough yet for that blister pack. Well, if you say that, then you probably are.
Yep.
And it's really helpful because it's all laid out. So here's the point. We're going to say this again. I've done it before. I'll say it a whole bunch more times. To stay in your own home, if that's what you want. And remember, we've defined home. You get to define home, whether it's in the family. Whether it's in the family home, whether you moved into a over 55 community, little plaza home, or you're in independent living, you've got a community there, or assisted living can be your home. If you want to stay out of assisted living, and that's okay, then you gotta do the work.
Yep.
You can't just accidentally
No.
stay at home. Well, you could, but you might not be in good shape if you
Well, and we run into it all the time where it's, we were talking about my wife's grandfather. He's 90 years old, still manages all of his medications by himself. I've tried to get him onto this program, but it's a situation where he's fully functioning right now, but how many doses are you away from missing on accident, or going for a walk and you miss your dose, and then you miss your evening dose, and then you miss your next morning dose, and all of a sudden you stand up and you fall down, and you have a broken hip, or a broken arm, or
and it's the breaking bone that really is difficult.
it's going to send you to the hospital. It's going to send you to the eventually discharged into some kind of additional care, right? So even though you feel like, yes, I'm managing these medications fine right now, you have to look at it in a term of how many doses away from this am I from getting to that next level of care.
It wouldn't take long.
It wouldn't take long. And honestly, once you get into that system, it's very infrequent that you get out of that system. So once you go to the hospital when you're over the age of, probably even 75, it's very infrequent that you get out of that, kind of that level,
that loop.
You're
in the
right.
loop.
So you're at the hospital. They're going to discharge you from there, depending on the severity of your injury, to a certified nursing facility. From there, they're going to either say, yes, they're capable of going home, which happens sometimes, or they need to be discharged into an assisted living facility. They need to be in at least an independent living facility, something along those lines, right? So very frequently after that initial occurrence, they're going somewhere else.
Yeah.
And it really starts with that. Like I said, the number one reason that we see people go into that system is because they're mismanaging their medications.
Got it.
And it doesn't take very long. It takes a couple of days or a couple of doses before something catastrophic can happen. So,
backing that up just a touch, get the Medisets, have your son or daughter or whoever, keep an eye on that. That's certainly a great step. Another thing I like, not just the laying out, here's the week, here's what I got to do, and it's a reminder, right? It's a reminder every morning, da-da-da. But what I also liked about this is that we have a professional who's looking at all of your meds going, why are you taking this one and this one?
Yeah.
They do the same thing.
For sure. Well, and a lot of times, Mark, what happens in those situations is that we see like our primary care provider, right, our regular doctor, and then we also have, a specialist that we go and see.
Yeah.
And if we don't have good communication between those two on what medications you're taking, oftentimes what you'll see is they will each prescribe something similar for a certain diagnosis. So we'll see, a patient be on 2 or 3 different types of blood pressure medication, or each one of those providers will send to different pharmacies for you. So those pharmacies aren't talking to each other. So it's just what we try and do is really get it all under one umbrella. So we have a specific medication technician at the pharmacy that packages all these medications. They call the providers. They ask questions to the providers. They're really an advocate for the patient.
Got it.
So they're going to call and make sure that you haven't gone to the doctor in the last 2 or 3 weeks since we last sent your medications out to you. They're going to make sure that you're feeling good about the way your medications. They're going to call the providers and make sure that you have refills on your medications, right? Because that happens all the time where you go to the pharmacy and then you're completely out of the medication, and then you got to go see the doctor, call the doctor to get that refill, all those fun things. So really it's a full service medication technician that is an advocate for your care overall. And again, it's a completely free service. The packaging's free, the delivery's free. People ask me all the time, what's the catch? And there's no catch. It's literally, basically what you're paying right now is the exact same that you're going to be paying with us. We have big contracts similar to what all the big box chains have with insurances. So the sooner we can get patients onto this service, the better. Now, like you were even talking about, you take 4 or 5 medications, and you're like, well, when should I think about this? Honestly, even busier adults should be thinking about this because you're on those medications for a reason, right? So if you feel like, oh man, I'm missing my medications, or I just don't have time to think about doing these, right? Like it's a free cost. It literally just comes out to you ready to go, and you can sit there and say, oh man, I missed Tuesday, or whatever else. So
let me ask one more question.
Yeah, go for it.
And then I'm going to come back. There's one other thing that I think is important for the at-homers. I'm going to age in place, whatever that means. But I am guessing that you also handle the insurance so that you submit the claim and you know what's going to be covered, you know what's not going to be covered.
Sure.
I mean, you guys have done this long enough.
Yep.
And so it's a very complete service.
Yeah. So as far as insurances are concerned, oftentimes you guys have heard of like prior authorizations and that kind of thing that insurance companies require doctors to basically fill out that they, yes, indeed did prescribe this, although I don't know how it would have gotten to the pharmacy if the doctor hadn't prescribed it already, right? So, but we send all that stuff off to the doctor. We try and make it as easy on the doctor as possible to fill those out, send them back to us. We communicate directly with the patient or the power of attorney or whoever else kind of needs that communication. But we'll let you know, like we'll keep you in the loop. But yeah, it's a full service. I mean, top to bottom, start to finish.
So now let's roll back. We didn't miss anything, but I just want to roll back and highlight a couple of things for people that are listening in. So first of all, they can do this themselves.
Yeah.
And all they have to do is make sure that they got the appropriate prescription in the appropriate amount, that they went and got it at the pharmacy, and that they then set up so that they're doing it every day appropriately and consistently. They have to interact with the doctor's office to make sure that it's getting renewed at an appropriate time.
Right.
I don't know how they're going to do this one, but they really need to coordinate the medications.
Yeah. Well, that one's a big one no matter what you do.
Yeah.
I've talked with plenty of providers out there. You were even talking like line all of your prescriptions up, take a picture of it, have it on your phone.
Yeah.
You know, at any point in time in your life, you should have a list of all the medications that you're taking. Period. You never know when you're going to go to the hospital, you get in a car accident or something else. They need to know that you're on a blood thinner. They need to know all this kind of stuff. So I would just suggest, just completely separate from this, that everybody have a list of medications.
Well, and not untypical is they go to the doctor's office, they're sitting there, and the nurse, because this is his or her job, well, give me a list of your medications. And at that moment, your brain goes absolutely blank. It's like, well, I'm taking a blood pressure, and then I'm taking a thyroid thing, and then
Exactly.
You're sitting there trying to remember that, and then it really makes it difficult for the doctor then to coordinate because you can't remember. Anyhow, so we can do all these things.
Yes, you can do all those things on yourself.
We can lay them up at home, and we can get our meds set. We got all of this that we can do, and we're of course not professionals. We're not techs.
Right.
We don't have all that experience in the background.
For sure.
And we aren't calling all the doctors to make sure they're talking to each other.
Yep.
So we could do that. I think that would take...
It's a lot of time.
I don't know how much time and a certain amount of oomph to get started and get it done. Or I'm suggesting that there's an option, and the option is... check out the services that are available.
For sure. Please.
Yeah, and the Mountain Care Pharmacy is one of them.
Yeah.
And here's what I'm hearing from Mountain Care Pharmacy is this is what they do. All right, and so what do I mean by that? You guys started by working with skilled nursing and assisted living, probably been involved in some memory care situations.
Yep, lots of memory care.
So you know this stuff.
Yeah.
You got the people that can do this.
Yeah. Yeah, like I said, so we started off as a hospice specialty pharmacy. From there, we've transitioned to adding assisted living facilities to our repertoire of services. And like I said, what we constantly see is just the mismanagement of medications. People that think that they're taking their medications just fine, and then all of a sudden they're not. Or even if you think that you're taking them just fine, when you don't have those multiple providers talking to each other, you might be taking those multiple medications for the same thing, right? So even though you're really on top of your stuff, if those two providers aren't talking to each other, then they don't know that the other one has prescribed to the other one.
Well, we were talking about this, and I'd like to mention it. Medication isn't the only thing involved here, the only factor, but it's a big one, and that is I've seen many times when folks move into an assisted living community and their health improves visibly.
Oh, drastically.
I mean, and why? A big one we've been talking about is medications. Somebody's managing the medications for them.
Yep.
So they're getting the appropriate amount at the appropriate time consistently. Then there's some other things too. Many of them are eating more regularly, better meals. When you live by yourself, and I don't do that. I've been on my own before, and it's such a pain to cook a real meal and clean up and put everything.
Well, especially for those people that have, had families for the past 40 years, kids and, grandkids and everything else. And then you try and cook a meal for one single person, and it's just...
We've done that. It took my wife years to get it down.
I mean... The kids will go out and they'll spend the night someplace, or my kids, they'll spend the night someplace, or it's the weekend and they're just not in and around. And my wife and I are cooking dinner, and all of a sudden it's just the two of us sitting down to dinner, and we've got a whole big pot of spaghetti or whatever else. And you're like, Oh, I get it. Like I see how it is. Like you've been used to cooking that direction for so long.
So that's another factor that we've seen is that their diet improves drastically.
For sure.
Sleep is usually a little bit better. Those are some things, but a foundational factor here is the medication management. And so our suggestion is simply this. If you can get a handle on that, and if you can do that consistently, appropriately, you're going to be in a better position to stay in your own home.
Yep.
No place like home. You can be there longer if you stay on top of this thing.
Yep.
And second of all, you don't have to do it yourself.
Yeah. Yeah. When I say free service, I mean free service. There's not. I mean, you're still going to pay your co-pays, like you would with any pharmacy, right? Like nobody's going to just, hand your medications to you for free unless you have some amazing insurance. Some really amazing insurance. Yeah. But there's no cost for the packaging. There's no cost for us to be your advocate, to call and get a hold of prescribers and transfer the medications from other pharmacies. I mean, initially when we bring people on, you don't have to be completely out of medications, right? So you can send all of your medications into us. We'll keep a record of everything that we have on hand. We'll use up your current supply, so you're not spending extra money to get onto this service. We'll use up your current supply, and when you run out of that supply, we just transition you over to our billing. So it's just it's then we deliver it for free. Then we then ongoing. It's a service that we find very valuable and very necessary to the community. And honestly, like I said, we run a hospice pharmacy. We deliver to all of these patients and all these facilities all over the valley. It doesn't cost us anything extra to be, 2 minutes down the road. I mean, we're literally driving past everybody in southwestern Idaho twice a day, every day of the week. So there's no additional kind of costs to any of this stuff. It's just... It's a no-brainer for me. I try to transition as many people as I can. Actually, Carly, who I'm sure most of you guys know, was how we kind of got into touch. She's got a friend that's, 20, 25 years old that needs some medication management that Carly's been helping her do. And this is a service that anybody can use, right? It's not just a wait till I have 40 medications, or that's way over exaggeration. But wait till I have 5 or 10 medications to do. I mean, if this is a situation where you find yourself even missing your 2 or 3 medications on a pretty consistent basis, get on this service. It's completely free. It does nothing to you to transition to this. And then once you do start getting a little bit older, and then the prescriber prescribes another 2 or 3 things, and another 2 or 3 things, and all of a sudden you're taking 8 or 9 medications. You've been on this service. You know exactly how to run it and how to do it. Yeah. And it's just constant over and over and over again. So don't wait until you're confused and overburdened with all of this stuff. As soon as you possibly can, reach out and get on to some of these services.
So the suggestion here is simple. Of all the things that you could do in the short term, the short run, the next step, a huge suggestion for the next step would be to get on top of your medication management, understand what's there, what it does, and if you have a question at all, there are programs available to help you do that, and you're not going to be spending tons of money on it. In fact, none money. And so our recommendation, it's a tremendous foundation for staying at home, if that's where you want to be, whatever that home is for you. And then you can go from there. You can build on that. But if you fail this one, the other things start to fall apart.
Yep, it's the slippery slope.
Yeah, because again, if you're not taking your blood pressure meds and you're sitting there and you've binge watched, Matlock, and that's from my mom, and then you actually NCIS, and you stand up too fast and get dizzy. Bingo, a fall and then a broken bone is really, really difficult to bounce back from. Yep. So Management, love it. Mountain Care Pharmacy. If you've got somebody that's doing that, awesome. Double check.
Yep.
If not, give Kevin a call. Kevin, how do we get hold of you?
The easiest way is probably just to give us a call at our office. The phone number is 208-287-4667. Pretty easy number to remember. And then just ask about the medication management services. It's pretty simple. It's pretty easy. And like I said, once we get you on there, we get you a specific technician that will be overseeing everything that you do. So they'll understand the billing. They'll know who your provider is. If you have questions, you can call and talk to the same person over and over and over again. And they'll have a real understanding of who you are and what you're actually taking, as opposed to, if you call a big box store or something along those lines, you never know who you're going to get. You never know if they're going to understand what you're on or who you are or whatever else. So we try and keep it, we call it a single point of contact, right? So we try and keep that single point so you understand they know who you are, you know who they are. It makes life so much easier. It goes back to that kind of community, that community feel, right? That's how to get a hold of us. That's who we are.
Give us that phone number again.
208-287-4667.
Now, imagine they could track you down on the interwebs.
Yep.
Mountain Care Pharmacy.
Yep, Mountain Care Pharmacy, Boise. You can Google that. Our website is MTN, like the abbreviation for Mountain, carerx.com.
Okay.
So.
And you guys been around for a while.
Yeah, we've been in service. Like I said, we started off as a hospice specialty pharmacy probably 13 or 14 years ago. So we've been around Boise for a long time. I've actually been there for going on 11 years now. So it's a very passionate group of individuals. The majority of our staff have been with us for a long time.
People ask me how they can tell whether they're looking at a good assisted living or memory care and a not so good one. A cheat is to always look at the staff and how long have they been there. And if you've got people that have been in place actually even more than 3 or 5 years, you're doing pretty good. So to be there 11 years and 10 years, that's an indication you're working with a real quality organization and that they know what they're doing. And you've got this organized. I don't have to be organized. You can do that for me.
Yep. Like I said, we're an advocate for the patient.
I love that. I really love that.
We're going to go out there. We're going to talk to all the providers. We're going to figure out what needs to be done. We're going to do it so that you don't have to, like you were saying, stand in line at the pharmacy. You're standing there waiting. You bring a new prescription, then you got to go shop around for an hour before it's ready. No, I mean, it's delivered to your front door. You can come pick it up from us if that's what you really want to do. If you need to get out and about or something along those lines, you can come pick it up from us. But it's a free delivery service. We'll drop it off at your front door. It saves a bunch of time, effort, money, all of it.
I think it's the very least. I think it's worth a look. I think it's worth a phone call. I think it's worth the discussion and find out how this can work for you. We want to support you being home, but we want you safe, and we want you in a quality situation. So, shift some of the burden off.
Makes it easier.
All right.
It really, really does.
Kevin, thank you for being with us today.
Thank
this
you.
is brilliant stuff. It's not just good. This is brilliant stuff. And I recommend it heartily. So give Kevin a call and make sure you're safe. Very good. Take care and stay safe.
Thanks, guys.